Are you trying to have a baby and just confused about the timing? Maybe you stopped contraception a little while ago and it's just not happening. You really want to learn how to optimize your chances. Watch this video to learn the best days in your menstrual cycle to try to get pregnant. I'm Dr. Lora Shahine. I'm a double board certified OBGYN and reproductive endocrinologist, helping people understand their cycles and when to start and time trying for almost 20 years, and I am here to help. Welcome to this channel. I have a reproductive health video that comes out every single week. I want you to learn all there is about your cycle, about IVF, about your fertility. There's so much information here. I'm glad you found it. Be sure and subscribe to this channel so you get my weekly reproductive health video. If you're trying to conceive and you really haven't started paying attention to your cycle or trying to figure out when you are ovulating, now is the time to figure this out, and I'm here to help. In this video, we're going to go over 4 main topics. Number 1, we're going to review the menstrual cycle. You got to understand the basics. Topic number 2, we're going to go over the fertile window, these special days in your cycle that you should be timing trying. Topic number 3, we're going to understand signs of ovulation. You've got to know when you're ovulating in order to know when to try. And topic number 4, we're going to go over the best days in your cycle to time trying to conceive. Stick around to the end of this video where I'm going to go over 3 common mistakes I see my patients make when they're timing trying to get pregnant. Topic number 1, let's review the menstrual cycle. Now, I've got some videos here under my period health playlist that teach you a lot about your period and what's normal, what's not normal, and the basics of the menstrual cycle. But in general, it's always important to review. This is just not something that we learned in health class, and we really should have. Most people have a monthly cycle. It's not exactly 28 days. Actually, less than 25% of people have an exact 28-day cycle, but it's just easy to talk about because it kind of separates it into 4 weeks. And in general, if you have a monthly cycle, you are ovulating. You have to release an egg in order to have a period about 2 weeks later if you are not pregnant. The first half of the menstrual cycle in general, which is about cycle day 1, the first day of bleeding, through ovulation, which can happen around cycle day 14, those first 2 weeks are the follicular phase. And this is when your body is making estrogen in order to recruit and mature an egg. In the middle of your cycle at ovulation, your ovary releases that egg. It should go into the fallopian tube where it should meet a sperm if you're trying to conceive. And then the second half of your cycle, your ovaries start making progesterone. This is called the luteal phase of the menstrual cycle to support the uterine lining that the estrogen helped build up and to create a wonderful place for an embryo that is the fertilized egg that was in the fallopian tube to come down into the uterine cavity, implant, and have a pregnancy. Now, if you are not pregnant, your ovaries stop making estrogen and progesterone, and the withdrawal of these hormones cause a period, and that's a shedding of the lining of the uterus. And when that bleeding starts again, you know that you're not pregnant, and that first day of full flow is cycle day 1, and so the whole cycle starts over again. Now, that is the basics of the menstrual cycle, and you're trying to time intercourse in the middle of the cycle around ovulation. Topic number 2, the fertile window. So the American Society of Reproductive Medicine has a great practice guideline and review document that's called Optimizing Your Natural Fertility. And in this document, they talk about the fertile window, or the 6 days leading up to and including the day of ovulation. And it's called the fertile window because this is the time in the cycle that it is optimal to be trying to conceive. So when you're learning your cycle, you need to learn when ovulation happens for you on a pretty regular basis, because it's actually the week before you ovulate that you should be having intercourse a couple of times, 2 or 3 times in this 6 days leading up to and including the time and the day of ovulation. So you have to track your cycles and understand when this window is in order for you to try timing trying to conceive in your next cycle. You don't want to wait until you're absolutely sure that you've ovulated or it's after ovulation to try to conceive. You actually want to try a few times beforehand. And the reason is physiology and biology. After the egg ovulates, it's viable and able to fertilize with the sperm for about 12 to 24 hours. Sperm is different. Sperm is viable and able to swim in the reproductive tract and look for that egg for up to 5 days after trying to conceive. So there's more of an overlap of availability of sperm than there is viability and availability of the egg. So you want to time trying a couple of times in the week leading up to and including ovulation. If you wait too late in the cycle and it's too late after ovulation, it's not going to be a successful cycle for you. Topic number 3, signs of ovulation. So you've got to know if you're ovulating. Now, I have in-depth videos on this topic here. I have one called How Do You Know If You're Ovulating? And I've got another video that's like the top 5 questions about ovulating. So you can go and watch those videos for a thorough understanding. But in general, there are physical signs of ovulation, and then there's some different types of testing that you can do to figure it out. Do not rely on apps. I should have included this in my top 3 mistakes at the end, but here's another mistake. Do not rely on apps to tell you when you're ovulating. This is actually another mistake that I see my patients make. So I should have left this for the end, but I'm going to give you an extra one here. Apps are sometimes making assumptions. And so you can put in when you got your period and they'll tell you when you're ovulating, but they make assumptions that everyone has a 28-day cycle. So if you're 75% of the population that doesn't have a predictable exact 28-day cycle every month, you can get confused by your app that's telling you when you ovulate. So don't rely on an app to tell you when you ovulate. Look for physical signs like increased production and thinning of the cervical mucus, little cramps, a little bit of more interest in getting physical, increased libido, that's from high estrogen levels. And sometimes people can actually feel little twinges. It's a term called middle schmerz, where in the middle of the cycle, they'll have one-sided discomfort, pain, awareness, and it's actually the ovulation. It's the egg coming out of the ovary and sitting on the surface of the ovary until the fallopian tube picks it up. So these are some of the physical signs. Tests that you can do at home are ovulation predictor kits. These are typically urine pee sticks that you can test kind of every day leading up to ovulation. And it's looking for luteinizing hormone. It's a hormone that comes from your pituitary gland to signal the release of the egg. And so it's typically negative, negative, negative. And when it's positive, that tells you you're going to ovulate in the next 24 to 36 hours. Another way that sometimes people see that they're ovulating is using basal body temperature charting. And this is done, you have to take your temperature every single morning before you get out of bed. It's hard to remember sometimes. Sometimes people will use an Oura ring actually instead of the thermometer, but it's interesting. And the understanding is that after you ovulate, when your body is making progesterone, your body temperature goes up a little bit. And so you have to see what the temperature is and see it go up in order to know that you've ovulated. The hard thing about that is the progesterone goes up after ovulation. So if you're waiting for that peak, that increase in temperature, it could be too late to time trying. But if you do basal body temperature charting for a couple of months, you can learn your own pattern. Topic number 4. So those best days to time trying to conceive to get pregnant fast are in that fertile window, those 6 days leading up to and including ovulation. So you've got to know your cycle. You've got to know when you're ovulating in order to figure out those days. And I tell my patients to have intercourse 2 to 3 times in that week surrounding ovulation. You don't have to have intercourse every day. You don't have to have intercourse every other day. There's so many different recommendations online. It can get really confusing. So think about the physiology. The sperm is viable for up to 5 days after trying. And so if you can just try 2 to 3 times, kind of spread out over those 6 days leading up to and including ovulation, you are going to have the opportunity that you want to get pregnant. So, on to the mistakes. These are 3 mistakes that I see my patients making, and I don't want you to make them too. Mistake number 1 is when someone has irregular and unpredictable menstrual cycles, they are not ovulating on a regular basis. And so don't wait. Make an appointment with a doctor today, whether it's your primary OBGYN, your primary care doctor, or a fertility specialist. If you have unpredictable menstrual cycles, if you're going for 2 or 3 months without a period, if you're bleeding every couple of weeks, if you really can't chart and figure out if you are not having a pretty monthly cycle, see a doctor. Don't wait. You don't have to try for a year if you are not having regular cycles. I have honestly seen someone who did not get a period for an entire year, and she was trying to conceive, and she had no idea that this meant that she was probably not ovulating. Don't make that mistake. You really should be ovulating, and you can really figure out with some flexibility that window of fertility. Mistake number 2 is waiting until you're sure that you've ovulated in order to try. So we talked about you want to try for a couple of times in the week leading up to and including ovulation. And a mistake I see patients doing is waiting for that magic go sign, whether it's a positive ovulation predictor kit, or it's the elevation in the basal body temperature, or it's a change in cervical mucus. You can still ovulate and maybe not get the signs. So you don't want to miss an opportunity because you're waiting for absolute confirmation. You want to try around the right time. And then when you get the signs of ovulation, that's reassuring, but you don't want to wait for them in order to try. And mistake number 3 is relying too much on testing in order to try. So ovulation predictor kits are great, but they don't always work. Basal body temperature taking is great. It helps you learn about your cycle, but it's not always perfect. And apps, I did talk about that, but I can revisit it. You need to listen to your body, and you need to just honestly try at least a couple times in that week around the middle of your cycle. Don't get so locked into, apps or tests telling you when to try. I really hope that that's helpful. I know it can be confusing. I know it can be frustrating, but I really hope that these tips help you. I don't want you to worry too much about exact timing. You're just trying to time within this window in the cycle to give yourself that opportunity. I hope you learned something from this video. Like this video if you learned something. Comment with questions that you have. Be sure and subscribe to this channel so you don't miss my weekly videos all about fertility and reproductive health. And as always, wishing you love, luck, and pineapples.